Hello everyone, I welcome you all to this 9th episode of Target Nursing Officer exam video. Question number 1. The perception or feeling of life of active fetal movement by woman is called option A. Braxton Hicks contraction, option B. Quickening, option C. Oscinder sign, option D. JIPMER sign. The correct option here is option B, which is quickening. Quickening is the feeling of active fetal movement by the woman during pregnancy. Braxton Hicks contraction are the mild and irregular contraction during pregnancy, especially fell in the second and third trimester. Oscinder sign is the increased pulsation. Increased pulsation fell at the lateral fornix, usually fell at the 8th week of pregnancy. And JIPMER signs are bluish or purplish discoloration of vagina. Question number 2. Condyloma Acuminata is otherwise known as option A. Bacterial vaginitis, option B. Pediculosis pubis, option C. Gonorrhea, option D. Genital warts. Correct option here is option D, which is genital warts. Genital warts are known as or also termed as Condyloma Acuminata. And bacterial vaginitis, also called as bacterial vaginosis, is a common type of vaginal infections due to overgrowth of those normal vaginal flora. And pediculosis pubis is a type of lice infestation. Lice infestation has 3 types. One is which is called pediculous humanus capatitis. It's head lice. And the second one is Thyrus pubis, is the pubic lice infestation, or also called crab lice or louse. And then the third one is the pediculus humanus. Humanus is the body lice infestation. These are the 3 types of lice infestation. One is which usually we saw in the hair, in the head. The second one is pubic, which is called Thyrus pubis. First one is pediculus humanus capatitis. Second one is Thyrus pubis, which infested in the pubic area. And the third one is pediculus humanus, is the body lice. And the option D is genital warts, which is Condyloma acuminata. According to the question number 3, according to the shape of bacteria, the branching filamentous bacteria are known as option A. Cocci, option B. Bacilli, option C. Spirilla, option D. Actinomycetes. Option A. Cocci. Cocci are spherical in shape, and they are divided as the monococcus, diplococcus, etc. And bacilli, they are rod-shaped bacteria. They also are divided into bacillus, diplobacillus, etc. And then spirilla are the shape is curve shaped bacteria, and they can even turn their shape like a corkscrew shape. And then actinomycetes are the type of bacteria in which the shapes have this branching filamentous. So the correct option here is option D, which is actinomycetes. Question number 4. Which of the following is an organic acid? Option A, tartaric acid. Option B, hydrochloric acid. Option C, carbonic acid. Option D, sulfuric acid. Correct option here is option A, which is tartaric acid. Tartaric acid is an organic acid, whereas all these three are inorganic acids. Question number 5. An abnormality of the nail in which red or brown linear streaks appear in the nail bed is known as option A, Bewes line, option B, koilonychia, option C, splinter hemorrhage, option D, paronychia. What are these Bewes lines? They are the indentation of the nails of fingernails or toes. And koilonychia are the also called as spoon nails, and splinter hemorrhage are the red or brown streak which appears at the nail beds, and paronychia are the infection around the nails, or infection of the tissue around the nails. So the correct option here is option C, which is splinter hemorrhage. So this is the Bewes line. You can see here this is what we call Bewes line. It is indentation of the nails, and this is what we call koilonychia, spoon-shaped nails, and this is the sometimes red or sometimes brown streak of lines which appear at the nails, and this is paronychia, which is infection. It's called if there is infection or inflammation at the tissue around the nails. Question number 6. A fat-soluble vitamin which is synthesized by the intestinal flora is option A, vitamin A, option B, vitamin D, option C, vitamin E, option D, vitamin K. These are all the fat-soluble vitamins, and among this, the question is asked, among this, which one is the vitamins which synthesized by intestinal flora? The correct option here is option D, which is vitamin K. Question number 7. The range of motion which involves the movement of extremity away from the midline of the body is called option A, dorsiflexion, option B, plantar flexion, option C, abduction, option D, adduction. Suppose this is a person and we draw a midline here. This is a midline. This is midline. So movement of this extremity away from the midline is called abduction. And movement of this extremity towards the midline is called adduction. And suppose this is the leg of the person. So the bending backwards of this foot towards the body is called dorsiflexion, and movement of this foot downwards away from the body of the person is called plantar flexion. So the correct option here is option C, which is abduction. Movement of extremity away from the midline is called abduction. Question number 8. Which of the following method is used for water purification? Option A, fluoridation. Option B, chemical mist. Option C, fumigation. Option D, chlorination. Correct answer here is option D, which is chlorination. Chlorination is the method used for water purifications. Question number 9. The following are the principles of hemodialysis except. Option A, diffusion. Option B, ultrafiltration. Option C, active transport. Option D, osmosis. Hemodialysis works on three principles. That is Number 1, diffusion. B, ultrafiltration. And third one is osmosis. These are the principles on which hemodialysis works. So the question asked here, the following are the principles of hemodialysis except. So except this active transport, so all are the principles of hemodialysis. So the correct option here is option C, which is active transport. It's not the principle of hemodialysis. Question number 10. Which among the following is a cardiac enzyme? Option A, alanine aminotransferase. Option B, serum amylase. Option C, serum lipase. Option D, creatine kinase. Correct option here is option D, which is creatine kinase. Creatine kinase is the cardiac enzyme. Whereas this alanine aminotransferase is the liver enzyme. And these two, serum amylase and serum lipase, is the pancreatic enzyme.